What is a joint? What do they do? A joint is a place where two or more bones touch each other. It allows movement and support. There are three types of joints. First is the fibrous joint. They're located between bones that are very close to each other, such as metacarpals and metatarsals. There are three different types of fibrous joints. Sutures are commonly found in the skull, although they can be found in other places. These joints fuse between two plates of bones, allowing movement to grow but still holding the bones together. Syndesmosis is a joint stuck between two bones to allow some, but mostly restricted movement, found between tibia and fibula. Gomphosis is the peg and socket joint found in the jaws and teeth. Next is the cartilaginous joints. They're found usually between articulating bones and prevent wear and tear. There are two types of cartilaginous joints. There's the primary and the secondary. Primaries are formed when bones are growing and provide strong support until they are replaced by actual bone cells. Secondary allows more movement than a fibrous joint, but still holds restrictions. It's usually found between the vertebrae and in the pubis area of the pelvic bone. The third type of joint is the synovial joints. They allow the most movement between bones and are also the most common. A synovial capsule covers each joint, which has an inner layer called the synovial membrane. The membrane secretes synovial fluid that helps soften the movement between bones. There are 6 types, which allow 17 different range of movements. First is the hinge with the elbow or the knee. Second is gliding with the vertebrae. Third is pivot, like the cervical area of the vertebrae. Fourth is ball and socket, like the hips and shoulders. Fifth is the saddle, which you can be found with the thumb. And the sixth is condyloid, which can be found with the wrists and ankles. There is the ball and socket, which is found in your hips and shoulders. There is the saddle joint, which is found in your thumb. And there's the condyloid joint, which is seen in your wrists and ankles. There are 17 different types of movements caused by flexing the joint. First is flexion, which is decreasing the angle of the joint. Second is extension, which is increasing the angle of the joint. The third is supination, angling the wrists so that the palms face up. Fourth is pronation, angling the wrists so that the palms face down. 6 is adduction, moving towards the middle of the body. 7 is abduction, which is moving away from the middle of the body. 8 is circumduction, moving in a circular motion. 9 is rotation, moving around the central point. 10 is elevation, which is moving upwards. 11 is depression, which is moving downwards. 12 is protraction, which is moving horizontally forwards. And 13 is retraction, which is moving horizontally backwards. 14 is plantar flexion, moving the foot so it points down. Dorsiflexion is number 15, which is moving the foot so that it points up. Number 16 is inversion, angling the foot to the middle of the body. And the last one, 17, is eversion, angling the foot away from the middle of the body. That's the joints for you.